Caitlin Dietz never takes for granted just how special her daughter Kieran is.
She's laid back, happy, wonderful.
Caitlin learned she was special in another way even before she was born.
It was at her 20-week ultrasound that her heart wasn't where it was normally, that it had developed outside of the chest wall.
She had probably one of the, if not the most rare congenital heart defect, and that is a defect called ectopia cordis.
We didn't have any idea that anything like that could happen. It was scary. The odds were stacked against her.
Kieran would need very complex, highly specialized surgery to survive.
And the only chance you have of treating this successfully is having an integrated approach where you can gather experts.
Cooperative integrated care is essential, but everybody's got their own job. We're teams of teams.
But we were just amazed when it looked that good.
Dr. Christopher Moyer is one of Kieran's pediatric surgeons. Dr. Jane Matsumoto is a radiologist who helped doctors see in advance exactly what they would be dealing with.
I segmented out the uterus, the placenta, the heart, and the liver. The big question here is, where was the defect? Where did the abdominal wall musculature stop and start?
Dr. Carl Rose is Caitlin's obstetrician.
There was much discussion that went on in advance. It is obviously almost a very unique circumstance, even for here at the Mayo Clinic.
As co-director of Mayo Clinic's 3D anatomic modeling lab, Dr. Matsumoto and her staff also provided the team with another priceless tool, a 3D model of Kieran while she was still in the womb.
This is life-size, one-to-one, exact detail.
For the surgeons, the model turned out to be a game changer.
When you take a look at the child, you see the liver is out, the intestines are out, as well as the heart. You want to fix both of those. But we found from the model that fixing both would put too much stress on the baby.
The first priority had to be protecting the heart and moving it into the chest. Because doctors did not want Caitlin to risk going into labor, a cesarean section was scheduled for the 37th week of her pregnancy. But several days early, Caitlin's blood pressure rose suddenly and Kieran's vital signs weakened. An emergency C-section delivery was scheduled immediately.
They pulled everyone together, about 60 doctors and nurses from 12 different teams in an hour and a half.
All of the advanced planning suddenly came into play. In spite of the urgency, however, pediatric cardiac surgeon Dr. Joseph Duraney says the baby's heart operation could not be rushed. So they used a C-section technique called an exit procedure.
Which means that the baby is partially delivered, but still connected to mom via the umbilical cord. So it takes the pressure off doing anything quickly to the baby.
This allowed Dr. Duraney time to stabilize the infant's heart. Remember, it had been suspended in amniotic fluid, attached only by its veins and arteries, which could not be permitted to twist. It also gave specialists extra time to safely put a breathing tube into Kieran's airway in preparation for her surgery.
So this delivery was done in the cardiac surgery operating room. And we had the maternal fetal medicine, we had ENT, we had the neonatal intensive care unit team, we had the cardiac surgical team.
It took them about 5 hours to place the heart back inside.
For Caitlin and Brian Dietz, the Mayo Clinic team had given their daughter all a mother and father could ask for their child, a future.
The possibilities for her are endless.
For Dr. Duraney and the team, it's a success story you can literally wrap your arms around.
It's the best part of the job. It's the best part of the job.
There's a satisfaction on so many levels, it's just hard to even describe.
One of those moments. She's with us, and she gets to go home.
Kieran will still need surgery to repair a heart defect in the coming months, but the ventilator tube that helps her to breathe is expected to be removed from her trachea very soon. She spent 4.5 months in the pediatric intensive care unit to make certain she was able to thrive, which she definitely has. By the time of her baptism at 6 months, her growth was on track with any other baby girl her age.
Seeing the child, their parents, and the joy that they have is incredibly gratifying.
For the Mayo Clinic News Network, I'm Dennis Douda.